You are listening to the Mary Jane Society podcast, where you will meet entrepreneurs, cultivators, scientists, doctors, and inventors in the cannabis industry.
I'm your host, Pam Schmiel, marketer and publicist in the cannabis industry. Today our guest is Peter Homberg. He's a partner in Dentons International Law Firm and based in Berlin. He heads up the European Cannabis Division and offered to join the show and share his insights about Germany's recent step toward cannabis legalization and what it means for businesses in the U.S. looking to enter the European market. Let's welcome Peter. So I just wanted to start with, of course, Germany's exciting news that they have legalized marijuana, and if you could kind of give us the details of what that exactly means. And do you think that the recent news will cause a domino effect across Europe as far as other countries coming online?
Yeah. Let's start with the legalization project, which the current coalition, actually has planned all the way back when they were elected. The coalition, the current government actually, decided that they would like to legalize cannabis for recreational purposes, over and above the legalization for medical purposes, which took place in Germany in March 2017. In October 2022, the government came up with the full legalization plan, very much like we saw that in Canada, where the cultivation of cannabis for recreational purposes should have taken place in Germany for the local market here, where distribution of that cannabis for recreational purposes should have been done through licensed dispensaries under government control. That was the original plan. This plan was presented, not officially, but there is no approval process in place to the European Commission. And the Commission actually made it very clear to the German government that they will not tolerate that because of the UN Conventions 1961 in particular, but also because the Schengen Agreement, which is the basis for the European Union, also prohibits the use of any kind of drugs, any kind of narcotics for recreational purposes, which includes cannabis. And the German government then had to find a way to legalize cannabis, not as we have seen that in Canada and other countries outside of Europe, and decided to implement a two-step plan. The first step, and that is the step which has been implemented in the cannabis law, in the CanG, as we call it right now, has passed last Friday's second and third reading. It's not yet in place, so it's still a draft law, but it has passed the parliament. Allows home grow for adults from up to 3 female plants, which for their own consumption can be cultivated at home. And the second part of that first pillar, which the government calls it, is the establishment of cultivation associations, which are allowing, or which allows the members, up to 500 members for each cannabis cultivation association, to cultivate cannabis for their own purposes. So, as you would say, it's group cultivation instead of a home grow.
Right. Interesting. Yeah.
So these are the two pillars here of that, or the two sections of the first pillar. What is important also to notice is that cannabis and THC-rated products will be taken out of the German Narcotics Act, which has, from our point of view, from my point of view, a positive impact on the medical cannabis market rather than on the recreational market. Also, the fines and the respective charges are reduced for possession of cannabis, and alongside we have the possibility that an adult can carry 25 grams of cannabis flowers in public, and he can actually also store 50 grams at home. So which is a significant amount in comparison to what is currently legal in Germany. And as such, I think it's a step forward. It's a step forward in the legalization process.
Mm.
Coming back to your second question, whether this has kind of a pulling effect on other European countries, I'm going to tell you, I'm not that optimistic on that, to say at least.
Okay.
If we look into the medical cannabis market, which now is nearly 7 years old, the pulling effect of the legalization in Germany of medical cannabis has been, I would say, very remote. There are, of course, EU member states which have had a look into that. Some have, to a certain extent, allowed and legalized cannabis for medical purposes, but not to the full extent as we have it currently in Germany. Other countries are thinking about it for medical purposes rather than for recreational purposes. However, there are countries like the Czech Republic, for example, who are very positively looking into that, like Malta. Well, Malta is a relatively small member state, but others are strictly against. So if you look into France, for example, they had this very limited medical cannabis project. And I do not believe, for what we have heard so far, that they are very much in favor of legalizing cannabis for recreational purposes. They are more or less still following the prohibition way. So I'm not that optimistic that it will have an immediate positive effect on that. However, besides the first pillar, there's a second pillar, which we can discuss in a minute, and a third pillar, which is very important to mention because it's not really published yet. But you can see that the German government, taking into account the experience from the legalization of the first pillar and, of course, of the second pillar, would like to lobby at the European Commission the legalization of cannabis throughout the European Union, at least allowing countries to go a similar way as Canada has done that before, instead of doing this home grow and cultivation association model.
Right. So I'm sorry, to be clear, other countries are asking the EU to loosen up on their restrictions and allowing them to not have repercussions if they go the route of Canada. So basically opening up their rules is what you would all have to do. Is that right?
Indeed, Pam, Germany was the first one who has actually brought that forward to the European Commission and failed.
Oh, okay.
There are other supporters of that policy to legalize cannabis for recreational purposes within the European Union. We have not yet kind of a formed coalition of EU member states approaching the European Commission. The German government is taking a path that we are going to look what are the results of the legalization. Do we really achieve what the arguments, what the targets of that legalization are? Do we really achieve that the black market is going to be reduced significantly? Do we really achieve that the protection of the use can be intensified? And do we really achieve that the consumers are getting a better product than what is available on the illicit market? So that is actually the goal of the German government. Let's see what are the results and then approach the European Commission together with other member states who want to legalize cannabis within the European Union. A long, winding process, I would say. So we can't expect that within the next 2 to 3 years, but in the time to come, I would say.
Right. And right. It definitely doesn't sound like a quick process for sure. So are you also saying that the medical program, do you agree that that countries should start with the medical program? We've done that in the United States. All the states, kind of tiptoed into it with the medical program, which it does seem like a good idea because it proves medical efficacy. They have to take those steps to prove to the public, but then it kind of gets lost and hangs in there for a long time. I kind of think like that's what you're saying about Germany, is it's been 7 years and there hasn't been anything that it's really integrating into the German, the wide population of the German community.
What has not been really published is that the German BfArM, which is comparable to the FDA, which is our Federal Institute for Medicinal Products, actually conducted kind of a survey, or if you would like to say even kind of an observational study, because the physicians who prescribed cannabis for medical purposes had to report to the BfArM about the patient itself, how old, of course, what kind of indication the prescription was for, and also what kind of product and the result of that. Unfortunately, not many physicians participated on that. The data which was generated was, I would say, relatively surprisingly low. But the data which we could draw from this survey, from that kind of study, was that it has indeed, in most cases, in more than 75% of the cases, positive effects to the patient. And I think that's something which is encouraging. The indications, if you look at the majority of all prescriptions went to chronic pain and pain. And the results were extremely good if you compare that to other clinical studies, at least. Of course, with some other pharmaceuticals where you perform clinical studies, that is, of course, even more decisive for possibility of prescription. We don't have that for cannabis. And we all know each and every patient is reacting differently to different cannabis products. It's a very unique, it's a very personalized medicine approach. And that's something which we have to take into consideration in comparison to, let's say, the other painkillers. But that is really encouraging. I fully agree with you, Pam. The results of 7 years of medical cannabis in Germany, despite the fact that we do not haven't reached the real number of patients which we actually could have reached for various purposes, for various reasons, is very encouraging.
And is it in the United States, we haven't been able to conduct clinical trials because it has been federally illegal, and it's kind of opening up a little bit. So we don't have that kind of data or medical, verification. Is that the same in Germany, where it's hard for people to get grants and research the plant because they can't get their hands on it and they're not allowed to? Or is there research going forward in Germany?
Research is allowed. You can, of course, apply for research with any kind of narcotic anyway, but also for cannabis. But what you should know is that cannabis here in Germany is not a ready-made pharmaceutical. It's not a finished product. It is actually defined as an extemporaneous mixture. Why has that been done? What does that mean? Extemporaneous mixture means that the pharmacist is the one who is actually preparing the product, the pharmaceutical, the cannabis product, according to the prescription the patient is handing over to him. So he's doing the quality control, the grinding, and whatever is necessary, packaging, waiting to prove that the patient is getting the right rate of the product. That is something which is necessary for an extemporaneous mixture. It's not getting to the carburetor, taking a pill out for other finished products. It's really an additional process at the pharmacy. With that, you do not have the necessity and the obligation to do a clinical study and do a marketing authorization. It's not necessary for also not to go through the respective price finding process which we have in Germany for finished products, for finished pharmaceuticals, for new finished pharmaceuticals. So which was kind of a big advantage in 2017 when the product came to the market for medical purposes, that immediately patients could buy it upon prescription in the pharmacies using actually what their physician has prescribed to them. And they didn't have to wait for a long clinical trial marketing authorization process to be finished. So that was altogether a big advantage for the patients. And that was also the intention of the government at that point in time, bringing the product as quickly to the market as possible after the legalization in March 2017.
Okay. And what forms are allowed in the medical market? Is it flower and tincture only? Is that?
It's flower and extracts, correct? Yes, that is allowed. We do not have any kind of ready-made pharmaceuticals. Maybe there's one example, of course, Sativex. There are other examples as well, which have gone through clinical trials before. But altogether, it is rather flowers and extracts.
Flowers and extracts. Okay. Okay. So I know everybody in the world is excited, and wants to jump the gun and get in there and, start bringing the brands in and things like that. So I know it is, the process is a way off, but just looking at a couple of the companies, the big companies that have kind of been making inroads in Europe, I'm just bringing to mind Tilray and Curaleaf, are big companies that have built cross-border infrastructures. Is that the strategy if somebody is thinking now that they want to start making their moves into Europe? Like what's the need in the market? I would imagine tinctures, extraction, and grow, because I believe I've read that Germany doesn't have a very big cultivation infrastructure set up.
Let's talk about the cultivation infrastructure which we have in Germany.
Okay.
Back in 2019, actually, the three companies who participated in a tender of the German FDA of the BfArM received respective licenses to cultivate cannabis for medical purposes here in Germany. It is Demican, it's Afria, and it's Aurora. The three companies received the respective licenses, altogether 13 licenses for a very limited quantity. It's only 10.4 metric tons for 4 years. So it's 2.6 tons plus 10% threshold. And that is relatively low in comparison to the need of the medical cannabis market in Germany, which is in the region of 22 metric tons or even higher per year. So we will probably see a shift in the cultivation possibilities in the future for medical cannabis as well. So it could change from a tender process, which is extremely bothersome, to say at least. I know that because we have represented one client in this tender. It was the preconditions to be fulfilled in order to receive a license very significant, despite the price, which has to be extremely low. There might be a change from this tender process to a kind of a licensing process for cultivation of medical cannabis, very much like we see that in some other European countries, rather than having a new tender after the 4 years will be ending. So there may be possibilities for these excellent growers from Canada to even apply for a license to cultivate cannabis for medical purposes here, not for recreational. Recreational is currently out in the first pillar. We haven't talked about the second pillar. The second pillar is maybe interesting for them as well, and that's maybe also the reason why they're building up kind of an infrastructure here, and it's definitely worthwhile to do that, which will be the establishment of scientifically controlled pilot projects, very much like we saw that in Switzerland, where in certain regions you will have licensed dispensaries who are going to sell cannabis products to consumers, and of course, scientifically controlled, which means they would like to gain data. What kind of impact does it have on the consumer? What kind of habits does the consumer have? What kind of impact does it have on society? What kind of impact on traffic accidents? And all these data which you can gain from these projects. We do not know at this point in time how this will be rolled out in Germany. We do not know who is going to participate in that, how will the respective participants be selected, how is the licensing process for the respective dispensaries are looking like. So this is a part of a new draft law, which was expected to be published before Christmas last year, which didn't happen. So this will be the second pillar which the German government has in mind, which they would like to implement in order to gain additional data, which then can be used for the third pillar to argue before the European Commission for the legalization of recreational cannabis.
Ah, makes sense. Oh, so the third pillar is the coalition, country's coalition to approach the EU. That's the third pillar, once they get all this data.
That's what they say. They would, and I call it third pillar. It's not really the third pillar. I call it because that's important from my point of view. It is the approach to the European Commission with all the data which have gained in the legalization process here in Germany, and to really lobby the respective legalization of cannabis.
And is that forming already? Germany's leading that coalition, and is it already forming?
Not that I know of. What has happened, we have seen statements, in particular from the Czech Republic, for example, that they very much understand the approach of Germany and that they would even follow Germany immediately if we would have legalized cannabis as outlined in October 2022. But that didn't happen. So we will see. I believe that there will be kind of a coalition forming process going on with various countries who would like, with very EU member states who would like to legalize cannabis for recreational purposes. But I think that's in the future. So it's not yet happening. But I think we are on a good track here.
Yeah, okay, great. And so you had mentioned earlier other companies that might want to enter the market similar to Tilray, or maybe, and Curaleaf and the others, maybe not so big, but the process you said is very, the bar is high for people to get in. Are they going to give the German people enough room to supply the country? It feels like they're looking to the outside. Am I right there?
I do not have my crystal ball with me, which I usually carry if you ask me such a question.
Oh, sorry. I know everybody wants to know. Somebody give us an answer.
Let me look at it. So what is not going to happen? I think that's clear. The garden center around the corner, having a greenhouse, will probably not be allowed to cultivate medical cannabis for the German market. Because you need to have not only certain knowledge, you have to have security. You have to actually follow EU GMP rules in order to really be compliant and provide the cannabis at the quality of a medical product to the German pharmacies and the patients. I think that is clear. So there will be significant higher requirements than for the cultivation associations for recreational cannabis. We will have quality control also there, but not to the extent as for a medical product. So those companies who may consider to jump on that licensing process or this licensing for the cultivation of medical cannabis should know what they are doing. And I think we have, of course, a great number of players here. The three companies which are already cultivating in Germany are, of course, in a pole position. They know how it should be done. They have fulfilled all the very tight requirements of the BfArM in their tender process. They can probably scale up to a certain extent and offer their products to the German medical market as well. We are still very much depending on the import of medical cannabis. However, the German government is seeing that it might be also interesting for the German industry, for the German cannabis industry to enter that market. And they may provide, and I would say they will provide this kind of framework legal framework that they can actually participate more than before in that supply of medical cannabis in Germany.
And also, as I know it's a little ways away, but as the other countries come online and being one union, European Union, your cross-border e-commerce is going to happen, it seems much quicker than here. And I wonder how that affects people's strategies as far as like, or it seems like that's the strategy that the Tilrays and the Curaleafs are taking, is they have a factory, you know, in Portugal, and they have, you know, in Italy, and, you know, they're already setting that up for the you know, the e-commerce or the trade between, yeah.
Which is happening already today. You know, we have a number of EU member states who are exporting cannabis for medical purposes into Germany. And like Denmark, for example, or even Portugal. So this is already happening. The precondition is that the cultivation of medical cannabis in those countries is allowed, which is not uniformly done at this point in time. So Greece is coming up as well with some interesting cultivators. As I said, Denmark. And this is already to a certain extent happening. That's the reason why also Tilray is present in Southern Europe. You know.
What kind of partnerships or help could you see, you know, outsiders coming in to help the German infrastructure? How do you see it coming together, or how could we help? Like,
Well,
let's
the point, yeah.
people in the United States, I'm obviously thinking about.
For the United States, I think it's necessary to really get kind of a federal law, at least regarding medical cannabis, in order to be one of the players on that market, not only internally in the US, but also externally, which is currently not happening, let's say, except for equipment and consulting, whatever. But products is still a no-go. And even Germany, as an importer of cannabis, medical cannabis products, would not allow any kind of export from the US unless you are fulfilling the respective requirements of the 1961 single convention and the two other conventions, 77 and 87, in order to be a player in that market. And states are not allowed to do that, so you need a federal law.
Yeah, I guess I was also thinking not an export yet, but thinking about their intellectual property here in the United States to protect it on an international level.
Going to happen right now is that a number of companies are looking into the recreational field right now. And today I've received a number of inquiries. Can we export our edibles to Germany for purposes? And the answer is very clear. No. It's very clear. No.
I bet you're getting a lot of calls now. Oh my gosh.
It is a very limited legalization. And we have to be clear on that. It's very limited. Following, of course, the UN conventions and the Schengen Agreement. So it's home grow currently and these cultivation associations. The second pillar, as I said, may be more interesting for the industry to participate here because it's already, I would say, the first step into legalization as we have seen that in Canada. But it's also not full legalization of recreational. So all those companies who have wonderful products, in particular THC-rated products, vaporizers, or whatever, you know, edibles, will not be able to enter the market at this point in time. We have to see how the legalization will go forward. And even with regard to CBD products, you know, this is so restrictive in Europe, even more restrictive than in the States, and as such, we will see how this legalization process for recreational will influence even the policy of the European Commission on CBD products. You know, we have this issue that CBD products, in particular food supplements, are classified in Europe under the European directive for novel food, which means if every food supplement which has CBD as an ingredient has to be properly registered with the European Commission and its the respective directorate. And this has been, for those who wanted to do that, very difficult. They have a number of companies have applied, but unfortunately, the European Commission has stopped that process by saying we need more safety data before we're going to register your product to be marketed on the European market, which is a nightmare for those who want to come to the market. That is easier in other countries, much easier than in other countries. So as such, it's still very restrictive, and even the legalization is very restrictive. So for commercial approach, this legalization of last Friday is not very attractive. But we will see how the next developments will be.
Right, right. Okay. Yeah, no, I know we're all excited, but it seems very promising, and even more promising on what your predicted third pillar would be. I think all that seems like a really good movement forward. It's just too early, obviously, to talk about any sort of licensing deals or intellectual property or
well, what we will see here, I think we haven't talked about that yet, but it's, I think, important to understand for your listeners is that the implementation of the law is relatively complicated. Not with home grow, that's an easy one, but with regard to the cultivation associations, it will need certain state laws, rules and regulations, which will be set up by the federal states in Germany, how to apply, how to get licensed, what are the preconditions for setting up such a cannabis as a club, as we call it, cannabis clubs. It's not really a club, it's actually a cultivation association, but nevertheless, let's call it for the time being cannabis. What are the preconditions? Who can run it? What we know from the law, for example, that you cannot outsource any kind of growing. It has to be done by the 500, up to 500 members. So they have to really cultivate that together in a group, get help from the so-called mini jobbers, where some people can assist them, but they cannot even touch the plant. This is only possible for the members. So we should not get overexcited about that legalization process. It's the first small but important step for the legalization of cannabis in Germany.
Wow. Okay. I was trying to understand what that meant, the cultivation club. So they could, is it similar to what they do in Spain? Is that it's okay? So it's totally different. Okay. Okay.
It's really different.
Okay.
To say the least. And it's a group of people who are allowed to cultivate cannabis for their own consumption.
So they have to be on a property. They have to have land.
Yes.
And they all get out there. Okay.
I think that's, if you're going to interpret the kanji, the Cannabis Act, indeed, that is what they intended, which is a wonderful idea, I would say, but is it practical? If you look into Berlin, for example, where could you actually set up a cannabis club away from schools, sports arenas, and kindergartens? Do we have space where you could cultivate? Probably not in Mitte, probably not in the quarters or in the areas around the city center, but outside possible. But that's still an issue here. The practical implications of that law, how can a club apply, to which authority, and how should they decide on security measurements, quality measurements, etc., is still an open question and needs to be formulated by the respective federal states in Germany, which is really a big task, to say at least.
Wow, that is amazing. Okay, and that's going to start forming, I guess, if people think that's a good idea, they now have permission to do that, to form. Okay. And then I guess the last question is, if there was a company or a group of people in the United States that you would be interested in hearing from, that to work with with Dentons, with the law firm. Is there something, like a group that you think there would be opportunities and that you feel like you could help shepherd them through?
Yeah, we have of course a very strong cannabis practice in the US and in Canada. I'm heading the European Cannabis Practice Group here in Germany, from Germany, and we are in close connection, close communication about any kind of business opportunities for companies from the US and Canada to come over to Europe. Germany is now the hub, I would say, with the legalization process going forward. And they are, of course, for those companies who are providing equipment, who are providing any kind of support materials for home grow and for the cultivation in the cultivation associations is a real market, fertilizer companies, seed companies. If seed is not difficult because seeds are only allowed to be imported into Germany from other European countries. Or the idea actually even is that the cannabis cultivation associations are providing the seeds for home grow, which, as we know, there's a different time difference. If everything goes through, April 1st will be the start of the home grow, and July 1st will be the start of the cannabis association. So somewhere in between, the home grower needs to get their seeds from, and that's only allowed if you really get your seeds from a certified cultivator within the European Union. That's what the law says. But all other equipment, which cultivation association needs, starting from lighting to fertilizers and whatever is necessary, that is a market which is interesting and will become interesting, because I can imagine that we have a great number of different cultivation associations who are popping up in each and every city, in each and every community. And we'll see how that works.
Yeah, and that's such a great point. Like, these are companies who could start making, the manufacturing and equipment people can start making their way over there. And I'll tell you, because it is a new industry and there are different needs in the supply chain, in the machine, and the packing. There's a lot of people developing and making new machinery here, and it's happening all the time in the cultivation and in the supply chain process, from pre-roll machines to co-packing machines that specialize in all these new needs that the cannabis industry has. It's really like an industrial revolution that's happening.
To a certain extent, yes. Should not become overexcited, but that's indeed true.
Yes.
I have been at the MJBiz conference in Las Vegas in December. And I had a look who could actually, if the legalization would come at that point in time, I was considering it could come, who could actually participate in the German market. There were so many companies who had significant and very interesting equipment for cultivation. As you said, packaging, whatever is necessary, track and trace, not to forget.
Oh, yeah, yeah.
So there's a great number laboratory equipment, for example, because there is one of these wonderful German ideas. Sorry to say that, but members in the age of 18 to 21, members of a cultivation association, should only get first a limited quantity per month, but then, of course, only flowers with a maximum THC content of 10%. So how do you find that out? You need testing. You need to really test.
Oh, yeah, our lab and we're going through all those problems right now.
Yeah.
I mean, we're going through all those, but there's all those areas are being worked on. So, okay, well, that seems promising for us.
It is. It is definitely, yes. And
okay, right.
and we are going to invite all those companies who have this specific knowledge and specific equipment to Germany, because this will be a booming market for them at this point in time.
Right.
Rather for them than for the importers or for the cultivators. That is for them at this point in time not that interesting. But everybody who is doing the support, who can provide equipment, who can provide knowledge, any kind of support, knowledge support, Even, for example, maybe a licensing agreement of a specific cultivar could be interesting. We'll see how this could work out.
Yeah. Well, that's definitely happening here. Patents on the different cultivars and things like that. I hear that. So, wow, Peter, thank you so much for your time. I really appreciate it. I really